We begin endoscopic carpal tunnel release by placement of the video endoscope into the wrist with its clear protective cannula and knife blade that can be deployed to enable the release of the transverse carpal ligament. The transverse carpal ligament is the structure that is tight in a carpal tunnel syndrome patient, and this is the structure that needs to be divided. Here we see the transverse carpal ligament, which is the horizontal white structure, which is beginning to be divided. The knife is sequentially releasing the transverse carpal ligament, and in this case we also identify portions of muscle integrated within the ligament which also needs to be released. We're doing this until we identify the palmar fascia, which in the endoscopic approach is not released, and this is protected. This is the palmar fascia here, the yellow longitudinal structure identified there. We then perform sequential checks to make sure that all portions of the ligament are released, that any additional bands that potentially could be pressing on the nerve are in fact divided. Here the palmar fascia does not need to be cut, and the transverse carpal ligament is confirmed to have been fully divided, and we bring the scope proximally towards the forearm to confirm that. Here we rotate the scope to identify one side of the transverse carpal ligament to the right, divide it, and then we rotate the scope to the left to identify the other side of the ligament which has been released. Palmar fascia is visualized in the foreground. Do some final checks to make sure that we have fully decompressed the median nerve and that there's no additional bands present that would be pressing on the nerve. And then we bring the scope, rotate that to show the median nerve, which is the white structure here to the right. This is protected. We then remove the endoscope and have completed the procedure.